Good evening, everyone, and welcome to our pre-recorded State Legislative Advocacy Week training session. This is our second session of the season of the week, and we're excited to talk to you all about advocacy in action. You will notice I am on a bus right now. I'm in transit, and we just want to acknowledge that we are recording this training because many of us are traveling back from Dr. Hazel Duke's funeral. And we just thought it was really appropriate. We wanted to make sure that you all got this training and got this information, so we're going to send it out tomorrow. But we also wanted to honor the life and legacy of Dr. Duke. And I feel like it's so appropriate that we're on the road coming from her homegoing celebration and, still talking about advocacy, because that was a life led in advocacy, a life led and dedicated to her people. And we live now to carry on that legacy. And so we hope that tonight's training can be an honor to Dr. Duke and the legacy that she has left for the association and for all the lives she's touched. And we hope that it's encouraging to you as you go forth in these very turbulent times to be the standard bearers for our people, right? We have much work to do and we are armed and equipped to do it. And so we hope that tonight's training gives you the tools that you need to fight and live in your honor and to honor Dr. Duke as well. And so I won't be before you too much longer, but I do want to say that as this training progresses, you will notice a theme, and that theme is to make sure that we are working from the same toolbox and we're sharing the same learnings and principles, and we're drilling down into all of the different issues. So we're going to talk about health, we're going to talk about economics, we're going to talk about environmental and climate justice, and we're going to make sure that you all have the tools that you need to continually fight for our liberation. And so with that, I'm going to turn the call over to Corey Johnson, our National Advocacy Director, to take us through.
Welcome, 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 everyone. Super, super excited to have our second installation to our training sessions for State Legislative Advocacy Week. We are super excited to bring our issue-specific lens for advocacy to this call. Right now, during these times of uncertainty, we've talked a lot about our 7-point advocacy model and how important it is for us to focus specifically for NAACP advocacy on transforming laws that are impacting our communities in a material way. And so I'm super excited to be joined by Dr. Chris, Dr. Tony, Abray, and Keisha as we work through some of the issues that are impacting our communities on the state, local, and federal level. And so with that, I will transition it over to Keisha with our DEI Center.
Everyone. So thanks for joining. I am Keisha Bross. I'm the Director of Opportunity, Race, and Justice, and I focus on inclusive economy and diversity, equity, and inclusion framework for the association. Next slide. So here's what we know. We know that the diversity, equity, and inclusion was not just started in 2020 to the response of Breonna Taylor and the murder of George Floyd and Ahmaud Arbery. We understand that the fight for diversity and equity and inclusion is ingrained in civil rights and what our association has been fighting for 115 years and more. And so throughout this journey, we know that the civil rights, though hard, we do have solutions that have come about in order to protect diversity, equity, and inclusion. We have the Civil Rights Act, fair housing, which allows people to have fair and equitable housing options, really in combating redlining, voter rights, women's rights, and equal employment. So we believe that diversity, equity, and inclusion is a framework that promotes fair treatment. But with saying that, we also understand that there is a very distinct systemic industrial racism that is embedded in our country and that has been the foundation of our country, its principles and policies for 400 plus years. And so in order for us to really address diversity, equity, inclusion, it is not a trend. It's not something of a quick fix. It's really the foundation of what our association believes and what we fight for. Next slide. And so we know that based on this new administration, back in January of 2025, we had executive orders that were very targeted to dismantling and disrupting diversity and equity and inclusion practices. These are specific, the ones that I have listed here on the executive orders are specific to several different topics. One, figuring that diversity, equity, and inclusion, programmatic training, and also the racial equity investments that federal agencies have done needs to be dismantled and go away. We know that there's a conversation happening around gender bias and gender identity. And we also understand that biological gender identity is something that's also being challenged. What we know is some of these executive orders are a way to really dismantle DEI, but some of it's also smoke and mirrors. It's a way to get people frenzy. It's not really a part of the law, and it's not a way that people could really justify how we think about civil rights. Next slide. And so what I want to talk to you about is the goals of these executive orders. So we know that the executive orders are in. Some of them have been challenged. Some of them are actively now in court and being challenged. But what was really the new administration's goals of these orders? So we know that one, they wanted to terminate diversity, equity, and inclusion offices, positions, and programs in federal government. Why does that matter? So in the administrations before, there was a true understanding that in order for us to have equitable solutions in this country, we needed to think about three things. The first is diversity. How does representation matter? And everyone have the seat at the table, that they have the ability to be seen, heard, and actually push policy and procedures in this country. The second is equity. We know that equality is an ability to have folks have the same advantage. Equity is a little bit different. Equity allows for you to have solutions that are specific to your needs and that everybody has the ability to have progress in this country. And inclusion. Just because you made the Thanksgiving dinner and you were invited to Thanksgiving dinner doesn't mean you have a place at the table. So inclusion is really opening the table for everybody to be seen and heard and feel valued. And the second is the termination of equity-related grants and contracts. This is really big when it comes to access to capital. So when you think about economy and the way that these executive orders matter, it really is dismantling and discouraging the way that federal capital is disseminated within communities. It's definitely an issue for impactful Black communities because we think about revitalization, CDFI, we think about ways that those monies are needed in real time. And so dismantling contracts that are equity related really hinders Black and Brown communities from progress. The other things we need to think about is the ways that federal contracts are distributed. So that's under scrutiny right now. And the reason that that's important is we think about corporate procurement, when we think about the way that businesses, Black-owned businesses specifically, have the ability to advance, this gives them that opportunity to advance. But if we dismantle it, they get pushed to the back of the pile. So we know white-led organizations have more of a significant opportunity within corporate procurement. So this actually gives us, this erases the opportunity for Black businesses to succeed. And the last is federal anti-discrimination laws. So we want to make sure that though contractually obligated federal funds are still available, this also allows us to completely eliminate that in the future. Next slide. So what's myth versus fact? So we're hearing a lot of things. You guys are seeing things in social media. You're seeing things in media. You're hearing things from associations and civil rights organizations across the country, not just ours. But it's really important to understand three very specific points. And I really want to make sure that you all take the time to read this because it helps you determine where to put your energy. If we are responsive to every single thing that comes out of the White House, we will be fatigued, tired, mentally strained. And I know my colleague, Dr. Chris Purnell, can talk very much about the importance of mental health. We will just be ragged. And so when we think about myth versus fact, let's go through that a second. The first is equal opportunity and anti-discrimination obligations are enshrined in the US Constitution. Executive orders do not and cannot change that. The United States Constitution is what it is. The second is the president has the ability and the obligation to hold and implement law, but he cannot rewrite them. And so some of the things that he's doing is not lawful, which is why you see lawsuits coming in and out of the Supreme Court. And the last is the executive orders also do not halt programs that are specifically designed to remedy ongoing discrimination, but it does allow for other organizations or federal agencies to continue the programs that they had in place when it comes to helping specific populations of people. And so an example is the Department of Transportation has a disadvantaged business enterprise program. Because that was implemented through Congress, the president cannot take that away. Next slide. So what is the association doing? So we have a Black Consumer Advisory, and let me tell you why this is important. The Black Consumer Advisory is really important to educating the Black consumer. We have 1.7, Black and Brown people have $1.7 trillion of buying power. Let me say that again, $1.7 trillion. By 2026, we'll have $2 trillion of buying power. And where we spend our dollar matters. And so if this association is specific to what we feel important when it comes to diversity, equity, inclusion, if corporations are not doing the things that are important to you, mission alignment, diverse hiring, corporate philanthropy, the ways that they look at corporate procurement, if they're not doing that, we're going to be able to call them out. Now, I want to be very specific to our members. Is this a boycott? The answer is no. And why is that important to understand? Because when it comes to boycott, the association cannot and will not take away someone's ability to have food, medication, and mental health, healthcare, and resources that are needed. So when you think about low income and marginalized communities, the ability to purchase retail and food access is very limited. And what we're not going to do is say, boycott a company that may be your only food source and ability to survive. But what we are saying with the Black Consumer Advisory and the pledge is you have the ability, if and when you have discretionary income, to choose to spend your income the way that you feel is mission aligned. And we're providing that information to you in real time so you understand what companies are sticking with diversity, equity, inclusion, and what is not. But we also want to make sure you have the ability to decide. Next slide. And so the last I want to leave our members with is something really important around national, state, and local advocacy, because it's one thing to just be in the know and educate. It's another thing to really advocate for outcomes that are really specific to how you are treated within your retail and buying power. And so nationally, we really encourage you to go to the NAACP website, click on the Black Consumer Advisory, and click on the pledge. And that is that you will really take ability to understand and know and educate yourself on what organizations and companies are doing the right thing and which ones are not. The second is challenge publicly traded companies, nonprofits, and philanthropic foundations. I cannot tell you how many times I see foundations and large companies say, we're no longer going to give to particular contracts because of race-based. They don't have to do that. And so you really want to make sure that it's important that you challenge those things and make sure that your money is being spent in a great way. The next is educate yourself on the executive orders. Yes, there's a lot. And yes, it's complicated. And yes, it's a lot of writing. But the more you educate yourself on what you have the ability to vote for and how those elections and executive orders impact you, the better you are to challenge those things in your community. The state is important. So we know that most federal executive orders will trickle down to the state. I'll give you an example. I live in a state where I've now seen a ban on DEI in the public education system, conversation therapy, all of these things that are really detrimental and hurtful to our next generation of leaders. And so you want to educate yourself on proposed bills, be an active part of the state legislative session, and fight. Really call your politicians in your state to make active change. Locally, this is actually the most important. So what people don't realize is your local DEI efforts trickle all the way up to federal. And so a lot of politicians actually stick the ban on DEI within budget. They will take away budgetary items and they say that it's because of budget or a lack of funds, but really it's cutting diversity, equity, and inclusion in your community. So make sure that you join your council meetings, make sure that you understand what your local budget is. And if you don't think that that budget really reflects the people and representation in your community, fight that budget and fight that openly, because all council sessions should be public. Next slide. Well, that's it for me. Again, my name is Keisha Bross. I'm the Director of Opportunity, Race, and Justice. Thank you so much for listening to Diversity, Equity, Inclusion, and Our Economy. And I'm now going to turn it over to, I think, Abray Connor, who's our Environmental Climate Justice Director.
All right. Thank you so much, Keisha, for that introduction. My name is Abray Connor. I am the director. I am going to turn this off. I'm the director for our Center for Environmental and Climate Justice at the NAACP. And I'm excited to talk to you a little bit about the work that we're doing within the center and some things that you can do to get involved. Next slide. So what I plan to discuss today is a little bit about the history of environmental and climate justice, why it's so important to the association, where we are now, and things that you can do at a local level. Next slide. So you may ask yourself, why are we centering Black communities when it comes to environmental and climate actions? Well, there is long-standing marginalization, despite the data that demonstrates that environmental racism is still at the core of many decisions. So we've known for many years that Black communities, frontline communities, communities that are fence line as well, tend to have more environmental hazards. So that means dirty air, dirty water, dirty soil in our communities that lead to problems, health problems, and can even lead to death. And even though we know that these issues exist because of race, many of the decisions continue to happen in our communities. The next thing is that the solutions that typically happen as it relates to environmental issues are solutions that may be good, but they're not solutions that come from our communities. They're not necessarily solutions that center the people who are most harmed. And there are typically also systemic barriers to be able to participate. So whether that is the fact that the communities who have the dirtiest air, who have the dirtiest water, who have dirty soil, also have issues having access to housing, having access to healthcare, having access to being able to have voting sites. All of these things are typically in the communities who are also facing the most environmental harms. So if we center our communities in the unique experiences that we have as it relates to environmental and climate justice issues, is actually going to create a better solution for everyone. It actually will ensure that many of the solutions that typically do show up in spaces where we aren't centered, that they will also reap the benefits of including and centering our voices in these problems. Next slide. So I'm going to talk a little bit about the history of environmental and climate justice. One, because it's helpful for us to understand that history and understand why this is a pillar and why it is a center at the NAACP, but also so that we can see how some of these patterns are starting to reemerge. Next slide. So back in the early 60s was really the time where I would say most of us recognized that there was the amplification and the height of the civil rights movement. Well, less than about a decade later, there was the first Earth Day. When that first Earth Day happened, you didn't necessarily see a centering of the communities who are actually most harmed when it came to environmental and climate decisions. But just about a decade later, there were landmark protests that happened in Warren County, North Carolina. And this happened because they were putting a PCB landfill in a predominantly Black community in North Carolina. The state Environmental Protection Agency had greenlit the decision. There were folks at the federal level who had greenlit the decision. And the Black community there in Warren County was like, absolutely not. We're not going to allow for you all to place additional environmental hazards in our community at this time. And who was there at that time to protest along with them? The NAACP. So NAACP was there to say, we're not going to allow for this Black community to have additional environmental hazards. And this was seen by many as one of the first times that at a national level, we were having conversations about environmental issues as a justice issue, as a civil rights issue, as a racial justice issue. And so that is really important because that's, again, almost 10 years after the first Earth Day, which was a conversation that was supposed to be around creating a better environment, a more sustainable environment for us all. And some of those same people were not necessarily there when this mass protest happened in Warren County to help this Black community to ensure that these landfill, that the PCBs were not put in the landfill in their community. Then shortly after that, the federal government actually released a study as it related to where some of these hazardous waste landfills were located across the country. And surprise, surprise, what we already knew to be the case, which is that these landfills were located typically in our communities. And so these two things kind of together really started the conversation around why we were having environmental and climate conversations that did not include the communities who were most harmed. And so in 1991, there was the first People of Color Environmental Leadership Summit. And so that's where they actually affirmed and came up with what it meant to do environmental justice work, to actually come up with the principles of environmental justice, a framework, so that people actually understood what that meant. And many of the principles build off of what we know in the civil rights movement, what we know from organizing principles, self-determination, and ensuring that the communities themselves were able to look at many issues that may show up in other areas in an intersectional way. Shortly after that, there was the executive order 12898 that President Clinton at the time signed, saying that at that time there would be a recognition at a federal level, at an executive level around environmental justice. And after that, we started to see conversations about a decade later, really intersectionally around natural disasters and what that meant for Black communities when Hurricane Katrina hit. And so even though there were conversations that were happening around environmental justice, that was really the time when people recognized that the climate justice conversation really needed to include our communities as well. Fast forward, we started to really see data pick up as it related to environmental justice and hazards that had happened across the country. And all the while, this is because there were folks like you all, folks on the ground who were pushing and saying, yes, it's great that we're having conversations, but we need more. And so if we think about it, the fact that the first data at a broad scale as it related to where environmental hazards existed outside of that release, the release from the U.S. General Accounting Office back in the 80s, at a way that people could interact with that information was in 2014. Also kind of lets you know that it's important for the advocacy to continue to happen. In 2021 was when we had Justice 40, which actually said that the communities who are most harmed had to be prioritized when it came to Inflation Reduction Act funding, when it came to federal funding that was flowing out of different agencies. And that, of course, was not enough. We've continued to have organizers, folks on the ground saying that we need to end our dependence on fossil fuels. We need to end our dependence on these types of industries who are adding to pollution in our air, water, and soil. That we can't continue to have these industries really be at the forefront of our communities, because we know that even if they come up with a short-term solution, those solutions are not going to, in fact, help us long-term. And then in 2024, we had for some time the first federal website as it related to environmental justice. But what we also know is that this new administration has worked to try to undo decades of work in the environmental and climate justice space. And so this is really important because you can see the trajectory, how long it took, and why it's also important for us to continue to fight. It hasn't necessarily been something that happened overnight, and it's going to take all of us to continue to have these protections in place. Next slide. So Dr. Ben Chavis, as many may know, used to be the head of the NAACP, and he was actually very instrumental in ensuring that folks knew what environmental justice was. He actually helped to coin the term environmental racism. And so when we think about the history of NAACP, environmental justice really is at its core. Next slide. So I'm going to talk a little bit about what our work looks like. So our work is around zero emissions. So again, ensuring that we do not have a reliance and that we are really trying to get rid of our reliance on fossil fuels, thinking about the ways that we travel, mass transit, school buses, things like that, that use a lot of emissions that are keeping us off track from being able to have a world that allows for us to not have more severe and frequent natural disasters, that doesn't allow for us to have access to clean air. Sustainable communities. So a lot of this work involves our work around natural disasters, around having clean water infrastructure, around having clean air, around having soil that isn't contaminated. Energy democracy. So what that looks like is ensuring that we not only have access to solar and other types of renewable energy, but also that for the branches and the state conferences who are looking at utilizing this to create wealth generation, that we're supporting those opportunities as well. And a right to a toxic-free environment. This is really around ensuring that we understand that there is no planet B, that toxics come in a number of different ways, including plastics, the false promises around recycling typically as well, and recognizing that there are better ways for us to move forward. Next slide. So I'm going to talk a little bit about our disaster resiliency work. So for the last over about decade or so, the federal government had been tracking what natural disasters actually looks like. And what we have seen is that over the last decade, that there has been an increase of the severity and the frequency of natural disasters in Black communities. And most recently, in the 5th National Climate Assessment, we were able to see that Black communities are more likely to experience flooding than any other community in this country. And what we also know is that this isn't by happen chance. What typically brings about a natural disaster is global warming. And global warming comes from having more pollution concentrated in certain places. And so the increase in natural disasters is very much linked to the fact that we have these, we're in the midst of a climate disaster, a climate catastrophe, if you will. Next slide. So this is actually taken from the 5th National Climate Assessment, where we see that the decisions that are being made around us having way too many greenhouse gases out in the atmosphere, that us not being willing to cut some of the emissions that are being used, the decisions that are made on a daily basis is actually increasing climate change for everyone. But also, as I mentioned before, that Black communities, like most environmental and climate decisions, are facing the brunt of these climate risks. Next slide. So one of the things that we're doing about this is because we recognize that there are going to be more frequent and severe natural disasters in Black communities, is that we actually created a disaster resiliency hub. And so on this site, you can actually get information around a number of different natural disasters that may impact your communities, what to do to prepare, what to do when you're in the midst of it, and what to do potentially after the disaster has happened as well as information around what this actually looks like, what the impact is on Black communities. The reason that we proactively created this even before some of the most recent natural disasters that have made the news is because we saw the information from the national climate assessments, and we knew that even natural disasters that typically aren't as severe or frequent in our communities, that we were going to need to create some type of hub to ensure that people had information, knew where to go, understood the risk and understood what they needed to do to prepare as these disasters hit. And so one thing that you can do, and I'll go through it again at the end, is to utilize our disaster resiliency hub on our website. It's by the time the disaster hits, oftentimes it's a little too late. Of course, you can use the information then, but it's good to have a sense of what it would look like to potentially prepare. And the way that this federal government is trying to remove information that would allow for communities to be better prepared and understand climate observations that would help them to understand when a disaster may hit is going to be even more important than ever for our communities to be equipped with the information available so that we are ready when these disasters hit our communities. Another thing that we've done in partnership with certain institutions such as Harvard was to make sure that we pulled information that used to be regularly available on the federal government website regarding where some of these community resilience zones are. So there are zones where you're more likely to be impacted by natural disasters. And so that information is also available, and you can pull that up now on, for example, Harvard's page and look and see if you happen to live in one of those places. Next slide. So another example of some of the work that we've done is around removing lead and copper from water. And this is something that's ongoing because when we started this work, this has been quite some time that we started this work, and we understand that lead in any capacity is unsafe for human consumption, and that many pipes across the country actually have lead in them. And they're lead pipes themselves, and there's lead in other things, paint and things like that as well. But removing lead pipes is something that should have been done a very long time ago. So we partnered with many of you all at the branch and the state conference level to actually draft comments to the federal government to say that there needs to be changes regarding the lead and copper rule, which would say that lead pipes need to be removed from communities within a specified amount of time. And so we were successful with that campaign and were able to get the federal government at the time to say that in the next 10 years, that lead pipes would be removed from pretty much all communities across the country. Now, Why is this important now? When the revisions for this rule came into place, we had a different administration. And it hasn't been revoked, but it is going to be important that at a state and at a local level, you're pushing to ensure that they are actually trying to remove those lead pipes. So the rule is there. Whether or not there's going to be a push from the federal government to get them to remove the lead pipes is questionable at most at this point. But because there is still a mechanism for there to be state level advocacy to ensure that these lead pipes are removed, this is a really important way to be able to make sure that your voice is heard for an issue that can greatly impact your health. Next slide. And the next I'm going to talk about is ending our reliance on fossil fuels. So we've been doing work on the ground with community partners, with coalitions to understand that we cannot continue the pathway that we are of having this reliance on fossil fuels. This administration has pretty much said that they want to escalate and move even quicker in the path of ensuring that fossil fuels are able to be used across the country. Now, why is this important to mention now? The main reason is there's going to be, and there already has been, a lot of misinformation around the benefits of potentially utilizing and continuing our reliance on fossil fuels. But what we have seen for decades and what we know is that our reliance on fossil fuels, number one, is leading to those severe and frequent natural disasters, is leading to a number of health issues in our communities, and there's no real health or other benefit for our communities to have this reliance on fossil fuels. So at a state and a local level, we're going to see more projects start to pop up where they're going to try to increase the use of fossil fuels in the community. And so it's going to be important for you all to be our eyes and ears and ensure that those projects at the beginning are questioned and hopefully stopped. And typically how that happens is through a process. There's environmental impact kind of reports that are done at a local level. And so typically any project that has some kind of that will somehow impact the community, they have to share what that impact will be. And they also have to give a description of the project itself. If this environmental impact report, if it doesn't have that information in it, it can likely be challenged on its face, like at the very beginning before they're even able to get started. And so that may be an opportunity to at least slow down the projects that are going to potentially harm your health in the future. Next slide. So what can you do now? I've talked about some of the ways that you can get involved, but one very easy thing that you can do is to make sure that at a branch level that you all have an environmental and climate justice chair and potentially a committee. Of course, at the state conference level, you should make sure that you're in contact with your state environmental and climate justice chair, but having that person also at the local level right now is going to be incredibly important. Attend those local boards and commissions regarding environmental plans, which we just talked about. Those are the places, those happen typically before it gets to city council. By the time it gets to city council, by the time it gets to the county level, there's been approvals that have happened. And it's not to say that you can't stop it, but it's not as easy as it would be potentially at those meetings that happened before. Watch out for the false narratives that we've already seen and we're going to continue to see around environmental protections. Right now is an opportunity to ensure, to what Keisha said earlier, that you're really reading, you're understanding that adding fossil fuels to the environment is not, no matter what, is likely not going to help. That creating opportunities for dirty water, dirty air, or dirty soil is not going to help in the long term. And questioning and feeling comfortable questioning the decisions that would lead to that. Sometimes the solutions may feel like they're quicker, but quicker does not always mean better. And so being willing to understand that those solutions that people may say this is a quick solution, it may also be a long-lasting health impact if you agree to those decisions. Connect with my center. Connect with the Center for Environmental and Climate Justice for strategy conversations. I have conversations with branches in the state conferences often, and I'd love to connect if there is something that is coming up for you. And then also share the resources that we discussed today with others. The more people who are thinking about these issues in this way, the more unified we'll be, the more we'll have the narrative that is unified, and it will help us to be able to move forward in a way that we will be successful. And with that, I will hand it over to Dr. Chris.
Thank you, Abray. Very, very important information that we had an opportunity to have a front row seat to tonight. And I just want to keep this theme going, this thread of equity, this thread of justice. So we're going to be speaking about health equity and the work that we do in the Center for Health Equity at the NAACP. You can advance the slide. I am Dr. Chris. For any of you who may not know, it is a thrill and an honor to lead the center. Next slide. Okay, so tonight I'm going to start us where we last left off in this conversation. Frequently, I want us to be able to drill down on themes, narratives, concepts that frame our understanding around health equity. So when I say health equity, I'm using the definition that is what I believe to be the most just, borrowing the language from Dr. Camara Jones. And she writes that health equity is the assurance for the conditions for optimal health for all people. Assurance is a key word there. Conditions is a key word there, and optimal for all people. So equity, very much going back to our earlier thread that you heard Keisha say, equity is rooted specifically in the needs, the priorities, the historical injustices, or even contemporary abuses a particular population may be experiencing. Hence, previously, we spoke about the cliff of good health. I'm not going to spend a lot of time here tonight. I just want to touch it and move. But we do talk about it during our monthly Health Leads Forum. So if I could give a plug to that, typically every second Thursday of the month, we get on at 7 p.m. Eastern Standard Time, and we dive into the latest issues in health equity, public health, population health. But this cliff of good health basically says that there are various levels at which communities or populations are pushed closer to the edge or even off the cliff and falling through gaps, and therefore experiencing premature loss of life, therefore experiencing disability and sickness, therefore experiencing higher healthcare expenditures, therefore experiencing medical debt, therefore experiencing economic insecurity. It's all linked. And as Abray was saying, what we are exposed to in our environment. So when I talk about environment, I'm actually talking about the natural environment as well as the built environment, the social environment, the political environment, the legal environment, right? So exposures to those things in the environment and either the presence or the lack of opportunity allows certain populations to live further away from the edge That's safe ground. And other populations are pushed closer to the edge, right? Are pushed closer because of this overabundance of risk. And sure, there are these measures, there are these safety nets that have been enacted. Some are more robust, some are thicker, some are more effective than others. But right now, we're living in a time where even those safety nets are being undermined, those safety nets are being erased, or the environments in which people live, the conditions that are present in those environments are in a worsened state, right? So if they fall off the cliff, right, because of those policies, because of those practices or abuses, and then that fence is not as strong, we see differences in access to care. And it's just not those upstream factors, what's in the environment. It's when you actually get into the healthcare complex, what type of healthcare are you exposed to? Are you exposed to high quality, very safe? Are you exposed to socially and culturally fluent care? Or do you have care that is not the right care at the right time, in the right amount, by the right person, right? With the right solution. And another way that people fall through the gaps and disparities or inequalities arise is not just in access to care, but in the quality of the care received, right? So when I just went through that right time, right place, right amount, right person, sometimes you may have access to care. So perhaps you have Medicaid. Perhaps you have insurance from the ACA marketplace. Perhaps you have Medicare. But the access to the doctor or the access to the hospital that you have is not high quality. So that's what we mean by the cliff of good health. And the work in the center and the work of the NAACP is about moving populations away from the cliff and, dare I say, doing away with the cliff altogether. Next slide. So based on that understanding and premise, this is the mandate for the center. I won't spend a lot of time here, but I think it's always important to ground the work that we are doing in our highest calling. You hear a lot in self-help spaces or spiritual spaces or religious spaces saying, be your highest self, your best self, right? So in the center, our highest calling, if you will, is this mandate. This is our true north, and this is what we are working every day to achieve. And this is how you and I are partnering together, how you and we are partnering together. So again, we are committed to driving equitable health outcomes and transforming healthcare systems, okay, through a comprehensive socioeconomic approach that values the whole person. A lot of words, mouthful, but every word is important. Next slide. And it's so important not just for you to know the mandate or our imperative, if you will, but to know why we do the type of work we do and the buckets that that work falls into. If you come onto the monthly Health Leads Forum, or if you participated in CRTI last year, plug for CRTI, stay tuned for the CRTIs in your regions, we spoke about the pillars for the Center for Health Equity. These are strategic pillars, if you will. So pillars that guide the activities that I do. Our newest team member who you'll meet not too long from right now tonight, Dr. Tony Price, and how our interactions with our board or with our National Health Committee or with the structures within the association really guide the type of work that we do. So we do work around access, right? So access to health insurance, access to a physician that is socially and culturally fluent, access to safe and high quality care, access to medications, affordable rates, access to even free and subsidized care, access to pharmacies. There are so many different access points and access levels. So we work around access to healthcare, as well as equitable health outcomes, meaning are there inequalities or disparities in a condition like breast cancer? And we know for Black and African American women that there are disparities around breast cancer. We die at higher rates than other groups, and our breast cancers are identified at later stages, and they are more severe or aggressive types of cancers that we are diagnosed with. Just one example, we work in the equitable food system space, right? So what does that mean? There is always a policy that we want to connect our end activities or actions to. So I'll start with the policy here, SNAP, right? Supplemental Nutrition Assistance Program. You'll hear me reference this again tonight. Do we have a farm bill which makes provisions to fund SNAP that allows SNAP to be funded in the most robust level to actually meet the needs of the populations in the United States, and specifically to meet the needs in the Black and African American community and other historically excluded groups, especially at a time when food insecurity is at an all-time high. What do we know about food literacy as communities? Do we understand what are healthy foods? Do we understand what are healthier processes, right, for farming, or healthier processes, right, for food packaging and things of that nature? That's also a part of equitable food systems. We could talk about food apartheid. We could talk about food justice, but I'm just giving you, just skimming the top a little bit tonight so we could focus on two specific examples. Inclusive healthcare system and infrastructure. I am of the 3%. I am a Black woman, public health and preventive medicine physician. In the United States, not even exactly 3%, but roughly around 2.7 or 2.8 physicians in the current workforce are Black women or Black men. That's abysmal. It is not equivalent to our population share. So that work in that inclusive healthcare system and infrastructure is definitely around pipeline programs, right? So programs that allow children, adolescents, those younger in their educational processes or careers to be exposed to the idea, the imagination of becoming a physician, the imagination of becoming a nurse, the imagination of being a physician's assistant, a physical therapist, or of the gamut of the health workforce, and then access to those opportunities to, be able to afford to train, to train at institutions or to learn at institutions that are humane, that are human-centered, that are anti-racist, and especially right now when there is a backlash, not just on diversity, equity, and inclusion, but there really is a backlash on Blackness, right? And so we've been talking about this across the association and in our work. And one other thing I'll say about the inclusive healthcare system and infrastructure, we also are doing work, we're really leaning into this. This is a new area for the center, is to think about how race-based clinical algorithms are deadly. And I'll give you an example. There are medical equations that say that Black people have different kidneys from other people. There are equations that says Black lung function is different from a white person's lung function. You and I know that race is not a biological construct. We know that it is through racism. We know that it's through medical racism that the understanding of Black humanity, Black bodies, Black physiology has been tainted. And there are robust efforts happening in public health and clinical healthcare to do away with those racist clinical algorithms, or to address where medical equipment, right, isn't appropriately designed to assess our function. And we see these things having negative impacts on who gets access to certain treatments. We see these things having a negative impact on life-saving interventions like transplants and things of that nature. So we're definitely doing more work in that space. And finally, healthy people, healthy communities, and health in all policies. And you may say, look, Dr. Chris, that sounds like, everything is in that bucket, because everything is. I tell people everything is public health. The economy is public health. Environment is public health. Access to healthy food is public health. Whether or not you have a doctor who listens to you is public health, right? So it is how you interact as a human within public or social spaces, within your community, within structures, within organizations. Next slide. So now that we've talked about those broad-based strategic pillars, I'm going to give you examples. And if you look to the rightmost aspect of the slide, I always want us to root our work in those advocacy levers, right? Those advocacy tools. If you've heard me speak before, look, I'm a PrevMed doc, and I'm always talking about the power of prevention, and I'm always talking about toolkits, right? And to borrow from the language of Adam Clayton Powell, what's in your hand? So what's in your toolkit? So oftentimes when we talk about this work, I don't want you to just get lost in the very specifics of what the work is, but I want you to think about, okay, how does this work move the advocacy wheel? How does this work use convening? How is this work an example of research? Just to call out a few. So under those pillars that I just briefly described, here are specific examples of the work that we are doing. Equitable food system. We have definitely done work around the Farm Bill. We have had drill down sessions around the Farm Bill where we have invited in our team members from policy and legislative affairs to come into our monthly health leads forums and to talk about the Farm Bill. In the previous Congress, we were talking about whether there was an opportunity to get a Farm Bill passed, and there wasn't. And we know that the Congress that we're facing today is even a less of an opportunity than the Congress that we faced last session, right? But we did a lot of Farm Bill advocacy, even during past state legislative advocacy weeks. And we will continue to advocate around the Farm Bill. We don't abdicate. We don't give up. We are realistic about what our chances are, but we don't abdicate or give up. If you were at convention, you saw the Eat Well, Live Better advocacy forum. We had a conversation at the local level. We uplifted a Black woman-led urban farming initiative, the Obodo Collective. We had a conversation with the past CMS administrator, Chiquita Brooks LaSure. We had a conversation around how policy is becoming more responsive to this understanding of food justice, if you will, and how Medicaid, depending on the state and their version of Medicaid, you could write a prescription for nutrition, or you could write a prescription for access to a farmer's market. So those are the types of conversations that we've had in the equitable food system space, and we will continue to grow those opportunities. But tonight, we're going to talk a lot about that access bucket, equitable access and health outcomes. A past example, Medicaid unwinding. You've heard us say, hands off our healthcare. And this has been a consistent conversation. I've been with the center a little bit over a year. And when I first started, we had already in the NAACP and the center had done serious, deep work around Medicaid unwinding. That was the process of protections that were erected during the pandemic so that people could not be kicked off of Medicaid. Those protections expired. And when those protections expired, people had to go through a redetermination process to see if they were eligible for Medicaid. And there was a precipitous decline in the number of people who are on Medicaid at one time during that process. And so we did a lot of work, scorecards, letters to governors, outreach and advocacy to governors. And all of you were a part of that success. So that's an example of the work that we've done under equitable access. We've done things around the IRA benefits, and we will continue to do things in those spaces. But more importantly, there's a different fight. There is a different fight. And the fight that we have now is not just about reforming Medicaid. It is about whether or not Medicaid will exist and will exist in the ways that it currently does. And will it be able to meet the needs of populations that have low incomes or populations that are isolated and have been historically excluded and do not have access to a job where they earn a living wage and they have an insurance product. And in the United States, we still have not achieved universal health care, right? So it's an all-out Medicaid defense. All right, and we'll spend a lot of time talking about that tonight. We won't talk about as much tonight protecting the ACA or Obamacare premium tax credits, which have allowed a record number of Black and African American people and all Americans to enroll in insurance on the marketplace, right? So private insurance options, right, that they're state exchanges or even a federal exchange. And so we will come back to that conversation most likely during Pertai and especially during our monthly health leads forums, because we know that those tax credits, which allow people to afford the insurance products on the marketplace, are set to expire at the end of this calendar year. The clock is ticking, right? And so we are in not a siloed fight. We are in not a one issue fight, but we are in a multi-issue fight, if you will. And that's what makes it all consuming. That's what makes it even more devastating, because there are so many ways that access is being shriveled, especially for people who need it. Next slide. Other examples of the work that we've done, matching it to the strategic pillars that I spoke about. You see the acronym JEDI there. That just means justice, equity, diversity, and inclusion. I'm a Star Wars fan. I, love the term Jedi. We should all be Jedi masters, and especially at a time where diversity, equity, inclusion, or DEI, as it has been said, and Keisha went through earlier tonight in a very detailed manner, is under threat. So we talk about that specifically in the healthcare delivery and health ecosystem. And I gave some examples of what that looks like, so I won't go further there. But other examples of our last pillar, not last in importance, but last just in order that it's been expressed, is the work we've done around the menthol ban or tobacco control issues, and a new initiative that hopefully you have already heard about. Hopefully either you joined the special forum that we launched on January 30th. If you're in California or you were at Image, perhaps you participated in our Ace Your Health breakfast reception that we just had in February. We will be doing other events like that across the year, and you're going to learn about Ace Your Health tonight from our new colleague, Dr. Tony. Next slide. So what of Medicaid? Wow, where do we begin? Medicaid is the largest insurance program in the United States. Depending on whether or not you're including dual eligibles, Medicaid covers in excess of 70 million Americans, and may go as high as 80 million or so when you look at those different categories. I want you all to understand just how important Medicaid is. Either you are on Medicaid or you have been on Medicaid at some point in your life, or you know someone that is on Medicaid, because of what it provides, the safety net that it is in this nation, and how devastating and detrimental it would be to roll that back in just a minimal way. 2 in 5 of all U.S. births are covered by Medicaid. 2 in 5 children have health insurance because of Medicaid. 1 in 6 non-elderly adults receive their health care through Medicaid. 2 in 5 non-elderly adults living with a disability receive their health care through Medicaid. 1 in 4 people with a substance use disorder, right, an addiction or mental illness, are receiving care through Medicaid. 3 in 5 nursing facility residents are able to be in what we sometimes call subacute rehab or a SNF. Those are words that you may have heard because you might have a loved one in a nursing home or some similar assisted living facility program. 3 in 5. So if Medicaid is harmed, and I'm going to use that because this is policy violence, whereby people are harmed, that's what's at stake. People living with disabilities, people living with substance use disorders and mental illness, people living in nursing facilities, adults, children, and births, the entire span of life, at the beginning of life and at the end of life. So if you drill down, you can go to the next slide, and we talk about, well, how does it affect our community in particular? I want you to know that nearly 42 million people from communities of color, so I'm talking about Hispanic or Latino, I'm talking about the Native and Indigenous populations, I'm talking about Asian Americans, as well as Black and African American populations, rely on Medicaid or use Medicaid to receive their care. And outside of the shame, outside of the stigma, because we are a nation that demonizes those who live in poverty, especially those who live in concentrated poverty. And poverty is a policy choice. It is a policy decision, right? And because it is a system rooted in a caste, and a caste is detrimental in and of itself, we have people who don't have access to care, so Medicaid is their only way to be taken care of. And we know that if you don't have that ticket to get care, and look, I've been uninsured at one point in my life, and I know what that's like. I know personally the choices that you make. You say, hey, hey, I know I'm really sick, but I can't afford to go to the doctor. You say, hey, is there a way for me to negotiate with someone who might take care of me? I have a serious illness, but I need care, but I can't afford the care. I can't afford the medications. And this is why this is such an important issue and why it touches so many of us, specifically in the Black or African American community. 58% of children use Medicaid. If we look at adults under the age of 65, we're talking about 25% of the African American community. If we look at adults over 65 and older, we're talking about 27%. And if we look at the total population of Black or African American groups, we're talking about 34%. So yes, all Americans will be harmed if Medicaid is rolled back, if Medicaid is slaughtered, if you will, right? If Medicaid is just aggressively cut, but Black Americans in particular will be harmed, and it just won't harm our health. It's an economic assault as well. Can you just advance the slide? I want to show what's at stake. So in the House Budget Reconciliation Plan, that plan proposed $880 billion in cuts to Medicaid. Again, $880 billion in cuts to Medicaid. I want you to stop and think. Think about all the people who rely on Medicaid. This is why we have to have an all hands on deck, all minds on deck, all hearts on deck, all boots on the ground, frontline trench in our elected officials' offices, screaming from the top of our lungs at hospital board meetings or wherever we can get people to listen to us. This is why it is important to show up now, because there is so much on the chopping block. I am a physician, and in our language, we say what is happening is like a hatchet job. When you need to, sometimes if you think there's fraud or abuse or you're looking for inefficiencies, go in with a surgical scalpel. You want to be very specific or meticulous. That's not happening. And in this type of just widespread cuts or devastation, if these are finalized and we see the intent from Project 2025 to what has already happened in the House, it will be catastrophic. It will be catastrophic. Next slide. And I want to tie this, as I begin to wind down this section, I want to tie this to multiple ways that people's health and well-being is being harmed through the access wheel. Think about SNAP, the Supplemental Nutrition Assistance Program. If you look at the proposed cuts to SNAP and the proposed cuts to Medicaid side by side, people are not just at the edge of the cliff. People are drowning. People are dying. People have died. And premature death will continue to rise exponentially if people don't have access to healthy and affordable food and healthy, safe, high quality care, right? So I want you to always think about in tandem things that are happening. So in 2023, the last year that we have complete data, an average of 42 million people, or 13% of the US population, receive SNAP benefits. This is widespread because of the levels of economic insecurity and food insecurity that we are faced with in our nation. And that was exacerbated, meaning heightened during the pandemic. And finally, SNAP is not just a program that Black and or African American people use. SNAP is a program that allows for all Americans to have access to food. 37% of SNAP participants are white, 26% are Black, 16% are Latino, 3.3% are Asian, and 1.5% are Native American. And so I think it's very important for us to understand that this is widespread devastation with disproportionate harm in our communities. Next slide. And so what can you do about it, right? And a call to action. We always want to root this work in a call to action. Show up, get loud, and be persistent. And one of the ways for you to show up, we see what's happening in the Congress, right? And we see the House resolution, a budget resolution that was passed previously, and we see what has been happening across these last few days. And we're going through a reconciliation process, if you will. But it is very important for you to use the power of your voice. If you go to our website, and we will send this out in the materials that all of you receive after watching this recording. But if you go to our website, there is an action center. And the action center allows you to put in your information, where you live, your name, your phone number, so that you can contact your representative and say, hands off my Medicaid, hands off of SNAP, hands off of all safety net programs, whether that's Social Security or Medicare, right? Hands off, because of the devastation is just not fathomable. And what's even more timely is the House will be in, House members will not be in session next week. So they will be in their in-district offices, in the communities where you live. Show up face to face, be counted. Let your voices be heard. It is so important that we always demand accountability from those who are elected to represent our needs, and to say, hands off our Medicaid face to face. So when you go to those in-district offices next week, right? You're not just going to sign up on the Action Center page on the website, but you're going to show up and you're going to get people in your family or people who you know have a story, who have a narrative, who have an experience with Medicaid or SNAP. You're going to get people from your unit or your branch, people from your state conference. And when you show up, you're going to show up with information. Not only will you have this recording, but the NAACP, alongside other civil rights organizations and health advocacy groups, we have authored a report called Medicaid Cuts Would Rip Away Health Coverage. That report goes with much detail around the harm that $880 billion worth of cuts would cause to all Americans, regardless of their political affiliation, and especially to Black and African Americans. So that information is going to be shared with you, and we also will hyperlink it to our website, and we will be sharing it as a part of our monthly Health Leads forums. And again, I'm going to say this before I pass it off to my colleague, Dr. Tony. Tell your story. Tell your story. Tell your story. So important. I said it 3 times. And it is important. And even if you feel like, I'm not sure if I have the courage, or if you say, I don't know if I want to put my business out there, think about telling your story, even in a way where if you don't use a specific name, and I've done this in the past. My father died during the COVID pandemic, and my father lived with chronic HIV infection and actually passed into AIDS at one point in his life. And I remember when my father was not yet comfortable with us publicly talking about his diagnosis, he gave me permission before he died. He called me Boo, and he's like, Boo, I want you to tell my story. And I used to blog about my dad in the Washington Post. You don't need the Washington Post right now. You can get on social media and you can tell a story of how Medicaid is impacting your life and what losing it would mean. You can go to a congressperson's office and you can tell that story face to face. We can think about how we gather and collect our stories and begin to use our stories to weave our power to hold people accountable. So I'm going to pass the baton to my colleague, because he's going to tell you about another side of a shop in the center that aligns with that strategic pillar around healthy people, healthy communities, and health in all policies, and how to use your voice and your power. Dr. Tony, take it away.
Good afternoon, everyone. It is a pleasure to see you all. My name is Dr. Tony Price, and I have the distinct pleasure of serving alongside Dr. Chris as the Senior Fellow in the Center for Health Equity. And it is fantastic to be able to do such important work at such an important part in our time right now. I'm here to talk to you all about the ACE Your Health initiative. And ACE is an acronym that stands for Actionable Insights, Community Assets, and Emerging Technologies. When we think about these 3 distinct parts, we are leveraging actionable insights through scaled research and community engagement, which we'll talk about in just a little bit. We are amplifying community assets for policy advocacy and civic health. An example of that is identifying specific factors that lead to optimal health in Black and Brown communities. We want to identify those factors and be able to communicate those widespread across the nation, right? And then finally, we are advancing emerging technologies such as artificial intelligence and machine learning with a racially inclusive lens. An example that I can give to you all for that, if you've ever been to a restaurant or you've ever been to the movies and you've had to go to the restroom and you've attempted to wash your hands under a sink that has a sensor on it, and it doesn't exactly turn on when you put your hands on it, it's because those sensors were not made with melanated skin in thought, right? So we want to make sure that any type of those technologies include us and include a racially inclusive lens. We can go to the next slide. When we think about actionable insights, this is really a national strategy to produce health equity insights and information. And we're going to do that a couple of different ways. We're going to be going across the nation, having one-on-one conversations with people in their communities. We're going to be doing a widespread survey, which we're going to talk about in just a little bit. We have a couple of focus groups that are planned across the nation. We're going to be doing some special activations. Dr. Chris mentioned it in her slides that we did something in LA during the Image Awards week. That was fantastic. And we were able to talk to the community about environmental health as it related to the LA wildfires, right? So we were able to do some things like that. And then we're also going to have some community engagement opportunities across the nation that we'll talk about in just a minute. And a couple of things that we are looking to produce as a result of this work, we're going to have a data analysis and we're going to be able to tell this story, right? We've talked about this a little bit this evening about telling your story, being a part of the conversation. This survey that we are doing, we're looking to have 12,000 completed surveys, not 10, not 11, but 12,000 completed surveys. And this is a way for you to tell your story and for us to get that out. And another production that we're going to have, we need to touch the lives of 50,000 people and have 50,000 members engaged in this ACE Your Health initiative. So one thing that I want to share with you, and if we could go to the next slide. One major way that we are advancing the ACE Your Health initiative is through the ACE Your Health Community Wellness Survey. So the ACE Your Health Community Wellness Survey asks about your neighborhood resources and assets. It's going to ask about health and healthcare. It's going to ask about neighborhood quality and affordability. And most importantly, it's going to ask about you. We want to collect some information so we can begin to tell our story about the issues that impact us the most. So if you have a smart device, please take it out, scan this QR code, and take the survey. It's going to take you just a couple of minutes to complete, and it's going to allow you to bring your voice into this national conversation and allow us to tell the story that matters to us the most. And if we could go to the next slide. And here you can see some of the things that we're going to be doing across the nation. In some of these light blue colored slides, or the light blue colored states, we're going to be doing community surveys, local engagement opportunities, and national activations. In the lighter purple states, we're going to be doing community surveys and local engagements, and then we're going to be taking the survey nationally to every state that we can across the nation. If we could go to the next slide. So our call to action, what is going to make this successful, right? See the survey, do the survey, share the survey. So you all have seen the survey on this call right now. Now that you've seen it, do the survey. Take a couple of minutes. Do the survey, share it with your colleagues. If you are a part of any social or civic organizations, share it with them, share it with your work colleagues, your friends and family, anybody that's in your circle, share it with them. That way they can tell their story as well. And finally, if we could go to the next slide, in the send out materials that will be included with this presentation, you're going to get the link to the survey itself. And on that same page, there's going to be a toolkit. Dr. Chris talked about it a lot in her previous segment that we are a big fan of toolkits. And this toolkit is going to help you be able to share the ACE Your Health Community Wellness Survey. In this toolkit, you're going to get an email template that you can use at your disposal. We're going to give you just a couple of words. You can make it sound like your own voice, and you can share it across your networks. There's some guidance for which groups you should target every month. I know March is Women's History Month. So this particular month, we're targeting some women's organizations, whether it is our D9 sororities, NCNW, and organizations of the like. We're targeting those organizations to spread the word. And finally, in the monthly health leads forum that Dr. Chris mentioned, we're going to be doing monthly check-ins, and we're going to provide some targeted technical assistance to help you be successful and to help us be successful in sharing this out. So once again, the ACE Your Health Community Wellness Survey. See the survey, do the survey, share the survey. With that, thank you so much, and I will pass it back to Corey.
Thank you so much, Dr. Tony and Dr. Chris. I also want to say thank you to Keisha and Abray as well, all of our center directors. We are super appreciative, especially because now more than ever, we need not cede our political power, right? We are powerful, we are smart, we are resilient, and we have the tools that are necessary to keep our people safe, to keep our people comfortable, and that rests in advocacy. And so I'm very thankful, very motivated. And one way that we can keep folks engaged, specifically with updates on our rapid response action alerts, is to text sign up to 20707. If you text that number, you'll receive rapid response action alerts in real time from the association. The last thing that we want to highlight when we talk about, mobilizing, when we talk about our 7-point advocacy model, when we talk about ways to get engaged in DEI and economy, from, understanding the political power that Black people have to really taking actionable steps, or making sure that we understand the model of the social determinants of health and how we are able to advocate. And like Dr. Chris said, share our stories, or, as Abray mentioned, being able to understand how environmental racism impacts our communities on a local level. I'm from Baltimore, and understanding the lead paint crisis. These are all things that we need to be able to train folks to do in real time. And so we want to highlight our Civil Rights Advocacy Training Institute. Kurtai is back. We are in session. We have Region 1 going virtually. We have Regions 3 and 4, April 4th through the 5th. We have Regions 5 and 6 on April 10th to the 13th. And we are still looking to determine what Region 2 and Region 7, what the location will be, but that news will be soon come. We are so thankful for you all spending this time with us, and we promise that we will send out the deck within 48 hours, and that you will get this webinar. Thanks so much. Good night.